Hi guys, welcome back to my channel. It's Itsleahjessica here. We are here today at Facial Artistry with the amazing Dr. Kuzman. He is the man. He's the one that does my fillers. He does everything for me. And I'm gonna let him introduce himself.
Good morning. Hi everybody. I'm Dr. Barry Kuzman and we work at Facial Artistry located on Skyline Drive in Tucson, Arizona. We have been in practice for 20 years now doing fillers and Botox. And it's a pleasure to sit and talk with you and answer the questions for all your friends and clients and everybody out there.
Oh, thank you. Yeah, people have been asking, when are you gonna do a questionnaire, with the doctor? So today is the day. I've been asking you guys, make sure you send me all your questions because I'm gonna be sitting down with the doctor and asking him every concern or question you guys have. So here we are, and we're gonna start with the questions. Okay, so I have questions for you. Are you ready for them?
Sure.
The first question is, do cheek fillers hurt?
On the average, cheek fillers do not really hurt. The method that I use is one using cannulas, whereby we introduce the cannula through a tiny little incision into the cheek, and the cannula actually dissects the tissues. It doesn't penetrate or perforate the tissues. It separates the tissues, and as such, there's really no pain associated with that. Some people use sharper needles and place the fillers in certain areas along the cheekbone, and that is a little more tender because of the sharp point that's entering the skin. My preference is the cannula because it is less invasive. I feel safer and less chance of bruising.
I didn't get any bruising, at all, but everyone's different. Everyone has different skin types. So the person said, I want to have my cheeks done, but I'm scared that they will look too big. What do you recommend when somebody is wanting to get cheek fillers?
I really recommend that they come in for a consultation because every patient's face has a different configuration, and depending on the face and where we want to accent the face, I would use different types of fillers in that situation. So the best thing is for the patient to come in. We offer free consultations and we can discuss the different types of fillers at that time.
Okay. And then the next question is, how much filler do I need?
Again, this depends on the patient's face or facial size, how much accentuation of the features does the patient want, where the fillers are going to be placed. So it really again depends on the patient, and it's only possible to assess this with the patient coming for an assessment.
Next question is, who is a good candidate to start getting fillers?
Well, patients come in for different reasons. Patients come in for reasons where they might have small lips which are not really in conformity with the rest of the face, or they may want them because they may be in some field of some type where their lips are really important in terms of their appearance, or they just generally want to do it to augment the appearance of their face. Many reasons, personal reasons, self-esteem, many reasons for them to come in.
The other question that I get asked a lot is, what are cheek fillers, what are they good for? Because a lot of people are like, why are you getting a cheek filler? And I try to explain to them, it just makes you look more youthful. It gives you more of a contour look. But what are your thoughts on cheek fillers?
Cheek fillers really depends on the age of the patient, because as we get a little bit older, we tend to lose the tissue in the cheek that's called the suture, which is the fatty tissue underneath the central part of the cheek, and the cheek starts to hollow from the effects of gravity. So the face starts to sag, and then you get the increasing size of the nasolabial folds on each side, and you get the marionette lines which deepen, and the face just starts to sag. So one of the reasons we use cheek fillers in that situation is actually to raise the face, to create more volume to the cheeks, to create a nice OG curve under the cheeks, and to make the face look more interesting, more heart-shaped, more oval-shaped, and it just is something that just elevates the whole face and makes the patient look much more youthful.
What is the most questions you get asked on a daily basis?
I would say people come in and they have a lot of hollowing in their temple area, which makes their face look a little bit elongated. It gives them like an hourglass appearance. And I find that the use of temporal fillers, or fillers in the temples, really elevates the whole face. And it elevates the cheeks, it elevates the nasolabial folds, it elevates the marionette lines, and actually makes the cheeks look fuller as well, and also tends to straighten the jawline a little bit. So I'm a real proponent of temple fillers, which you've had as well, and I've noticed it made a huge difference to your situation.
Definitely made a huge difference. Not in just the way my face looks, but in how I apply my makeup. It looks nicer on camera, and it's like I always get compliments. It's like, oh my god, your cheekbones are so nice. It's like, thank you. It's like facial artists never like stop talking about it.
Well, we can show a few things that you might have had done and just show how it's actually affected your face.
Yeah.
I remember when Jessica came in, she had hollowing in this area here of the temple, which made her upper room here look a little bit more prominent on either side, and it gave her a hollowing effect. It was almost like an hourglass effect to her face. It made her face look a little bit longer, so we placed some filler into the actual temple areas here, and one of the effects of that is to raise the eyebrows on each side. It also fills this area out here in the temple area, which tends to make the face start to look a little bit more oval. It does elevate the cheek, and it also creates this OG curve here, which you can see just underneath the cheek, this little hollowing and accentuation below the cheek. And it also tends to straighten the jawline over here. So just putting a little bit of filler over there actually lifts the whole face. Very hard to believe, but it actually does that. Obviously, if it's not enough, we add filler to the cheeks. And the way I do that is, as I mentioned earlier, is I use a threading technique where I'll inject a little bit of filler right over there with one little needle tip, and with another needle tip using a cannula. I'll go through this area over here, and then I'll layer the filler along the actual maxillary bone on the actual bone surface, leaving room to create this OG curve and this indentation here, which highlights the cheek. It gives the cheek a lovely form, and also highlights the jaw. In Itsleahjessica too, we actually did her nose, reconstructed her nose with filler and Botox, and you can see that she has a nice, smooth line down the center of her nose, a really nice tip. We did raise the tip of her nose a little bit here. You can see the nose tip is raised, and we smoothed it out, and I think she has a very beautiful looking nose. Also, what it did at the same time was raise the upper lip. And then you can see we placed some filler in her upper lip, and you can see the contour of her upper lip. She has a wonderful curve to her upper lip here, and then she also has a lovely curve to her lower lip there, which really augments the lower third of her face. She fortunately does not have anything under her eyes, which was great. And I think that as a whole, we placed some also Botox in the belly area, the sides of the sides of the eyebrow, which also raises the eyebrow, and placed some Botox in the forehead here, which has made the forehead nice and smooth. And as you can see, she has a very natural look, nothing abnormal, nothing that's from somebody else's lips that based on Itsleahjessica. She has her own features, and we just augmented her features. And that's the way I do things. I like a very, very natural look, and nothing that's outstanding that people notice as being unusual or not fitting to that face. The other thing that we did on Itsleahjessica is we did Cabela, which is the injection of a deoxycholic acid underneath the muscle that goes all the way down the face. We call it the platysmal muscle, which covers the whole face, all the way from the forehead, all over the face. It's a very thin muscle, goes down into the neck and ends onto the sternocleidomastoid bone over here in the front of the chest. And then you get a little fat pocket that sits underneath the chin here. And what we did, we injected this Cabela into the area of the chin, and as you can see, she's got a nice smooth chin here, no evidence of any fatty tissue protuberance over here. It has also defined her jawline very well over here, as you can see, and I think she got a beautiful result from that Cabela.
Yeah, I really like the Cabela. You can tell a huge difference just within because you do get swollen the first few weeks, you're swollen, but then it goes away and your feels just like.
And the advantage and the beauty is that the Cabela is permanent.
Oh yeah, that was another question. Are cheek fillers permanent?
Cheek fillers are not permanent. Depending on what cheek filler is used and the thickness of the cheek filler, they generally last from 9 months to a year. So as I explain to patients, consider their face like an empty tank of gas. What we want to do is we want to fill that tank up to 3/4, and then once that 3/4 level goes down to half, you just want to refill it up again to 3/4, and the more we do that, the longer the intervals between treatments and the less amount of filler we're going to use per treatment. By the same token, the collagen tissue, elastic tissue, the hyaline tissue stays stimulated all the time and maintains that continuous beautiful look on the face. And then we also like to feed the skin with products that actually stimulate your collagen, elastic and hyaline tissue. We like to moisturize and hydrate the skin with moisturizers, and it's very important to protect the skin as well, and we use sunblock for that. It's very important to understand the sunblock scenario, because the sun rays consist of UVA, UVB, UVC rays. The UVA and the UVB rays are all protected by the sunblocks that you buy in the store, and that's the zinc oxide that protects you against UVA and UVB. UVC is really unimportant because it's a short wavelength and is absorbed by the ozone. The visual light spectrum where we see, and on the other side of the visual light spectrum we get infrared radiation. Infrared radiation is actually very dangerous radiation. It's probably the worst of all the radiations. And that's the kind of radiation where you might be sitting on the beach and you just feel heat but you're not burning, or you're sitting on concrete or on tar, and again you're feeling that heat but you're not burning. Sometimes when it's very cloudy outside you think that you're actually covered by the protection of the clouds, but you're really not, because the rays diffuse through the clouds and break up into the infrared radiation, and that is the most dangerous of all the radiations, I believe. And so you want to use sunscreens that actually cover UVA, UVB and UVC. And they're really only medical grade sunscreens that actually do cover those light rays, which I think is very, very important, especially living in Tucson, Arizona, because we have the second highest incidence of skin cancer in the world, second to Sydney, Australia.
Yeah, that is one thing. Always wear sunscreen. Doesn't matter where you live, just always wear it. It's the best thing for your skin. Another question was, who is a good candidate for under eye fillers?
Under eye fillers are difficult in terms of what they do, because it's very difficult to distinguish sometimes between a filler that will occupy space under the eye and people who have a little bulging of the skin underneath the eye, what we call a festoon. One has to be very careful not to inject patients who have festoons with under eye fillers, because it's going to defeat the purpose and not create any good, and will probably have to be removed. The first thing I like to do is to try concealers. I mean, there's a total block concealer, and there's also a thiamine concealer, which actually will cover the dark areas under the eye, and I actually like the thiamine more than any of the other concealers, and that's the first thing to try. If there is loose skin under the eye, actually the use of some preparation H actually helps in very small doses underneath the eye, because it does tighten the skin and does help a lot. But if you are actually have a significant depression, there's blueness there and there's loss of fatty tissue, then we do use fillers, and we use a thinner type of filler. One of the ones that I do like is called Belotero, which is a thinner, softer filler and is used in that area, and one gets good results with that.
Do people get confused when they say, oh, I want under eye filler, and some have like poofy eyes, or some have like wrinkles with poof, you know what I mean? Like, because some people think, oh, if I get under eye filler, like it's just gonna smooth it out.
Yeah.
They have to have like a certain hollowness to fill it in, or like what are the procedures, or what type of tips do you recommend when it comes to that?
Yeah. If there's folding of the skin under the eye with some wrinkling underneath the eye, then we can use some Botox in very small doses, and that'll thin out that area and also tend to lower the little tiny bit, so that the eye looks a little bit more open, and that becomes much less noticeable and gets rid of the wrinkles under that area. We use that in combination with certain eye creams as well, which will tighten the skin in that area. And again, the concealers in that area are also very useful. And I'm a little more conservative on the under eye fillers, because I've seen lots of problems in the past from people who've used these not in the correct fashion, and people have unrealistic expectations. So I'm more conservative with under eye fillers, and the only specific indications to use the under eye fillers, and that's when there's a hollowness and you're actually seeing the peribulbar fat through the orbital septum and the thin skin, which creates that darkness and that depression in that area. Those are the good candidates for, those patients are good candidates for under eye fillers.
And another question was, do cheek fillers get rid of wrinkles on the cheek area?
Depending on where the cheek area is, yes, cheek fillers do get rid of it. Sometimes not completely. We may have to enhance that or augment that with using some Botox, especially in the crow's feet area. But many times we use fillers in the cheeks, and the wrinkles actually on the cheeks themselves.
Oh, okay.
There's another method to raise the cheeks and also to raise the marionette lines and the nasolabial folds, as well as shallow the actual jowl, and that's using a suture. And there's a new suture that's out that's called a silhouette suture, which you can see here has a needle on one end and then has a suture in between the other needle. And basically what we do is we inject local anesthetic in the area, 3 areas of the face after assessing it, and then we make a little opening just in the central suture, and then we will place this one needle through that central opening and take it out, up and out through the one side of the cheek, and then the other needle we place through that central area and take it down and put it out through the lower part of the cheek. And then we straighten the suture, and actually the suture has cones. I don't know if you can see the cones, but the cones are in between my fingers. I don't know if you can really see that. You can feel it though. See the cones?
Oh wow.
And so what happens is when you pull the suture, the cones tighten up and catches the tissues into the cones and actually lifts the cheek, and it's been very, very successful. The great advantage of this type of suture is that this material, the suture material, actually converts to collagen, natural collagen, and does not remain as a foreign body. And we will usually use between 3 and 4 sutures per cheek, on an average 3 sutures per cheek. And the results have been really wonderful.
Wow, that's cool. So is that like another alternative to lifting from the cheek fillers?
Yes.
Yeah. Wow.
This is another alternative. It's just that it has more effect than the cheek fillers. It will lift a larger area of the cheek.
Oh, like it's more of a lift.
Mm-hmm. And it can also be used in conjunction with cheek fillers as well.
Oh, nice. So yeah, guys, set a consultation, and that is cool.
And this is really cool.
Have you seen results like?
Yes, we've seen results, and it only takes about 40 minutes to do, 30 to 40 minutes to do. The results take about 6 to 8 weeks before you see the actual results, and it's really painless. It's a painless procedure and a very easy procedure to undergo.
Wow, that is cool. Something so simple can lift your face. And how long does that last?
This usually lasts between 18 months and 2 years.
Oh wow, that's a longer.
And maybe longer.
And this dissolves in your body?
It dissolves and becomes collagen.
Wow.
And that's what I like. It becomes a natural product of the body, as opposed to other sutures which were used previously and which had like barbs on them, which sometimes don't dissolve 100%, and one can be left with scarring and epithelialization around the tract of the suture, and you can see it from the outside.
Oh wow.
Not everybody's doing this at this point, but it's relatively new. It's been done in Europe for many years, and in this country for a few years. But I do like the fact that that actually turns back into collagen, which is a natural product of the body. If you ever have any other questions, please text Jessica, and I'm happy to sit down again with her and go through your questions and answer them. If you have any questions, you could call us directly at Facial Artistry, 520-790-1234, 520-790-1234.
Thank you for having me. And don't forget to subscribe, hit the bell notification so you get notified every time I post a new video for you guys. And make sure to look at the link down below, because I will be posting all the links to the doctor, if you want to set a consultation or anything. And remember to mention me. I don't know if do you get a lot of calls?
Yes, we do get a lot of calls.
They always ask me if there's some type of like code or something.
If you just mention Itsleahjessica sent you, we offer you some additional discount as well.
Yeah, so don't be scared. Call today, set a consultation, and believe me, you're gonna love it here. It's such a beautiful aesthetic scenery. It's so nice here, and there's such a good vibe. I love everybody here, and yeah, it's like I wouldn't go anywhere else. Like, he's just amazing. I wouldn't trust anyone else with my face. That's all I gotta say.
While we're here, I do want to compliment my staff. My staff are really wonderful. They really take care of you. They're concerned about you. You really mean something to every single one of them. They're all highly trained, and our motto is to be at the cutting edge of everything that we do, and just do the best for our patients in the most natural way possible, with the least risk and the highest safety.